On the debate tonight, government's own admission shows why healthcare is crumbling in Bihar. 154 babies died in Bihar due to encephalitis. But the government denied responsibility. Now, Bihar government's affidavit in the top court reveals just how short-staffed healthcare facilities are.
The encephalitis issue continues to be in the scrutiny of the Supreme Court. Yesterday, it was the Bihar government which submitted that although there was a shortage of doctors, it could not be blamed for negligence. Today, the central government has weighed in, saying that despite health being a state subject, the government of India is also doing its bit. It went on to inform the Supreme Court as to how it intends to deploy doctors in advance next year before the onset of this disease.
Mirror Now ground reports filed from Muzaffarpur had completely exposed this very reality of Bihar. But despite mounting proof, Nitish Kumar and his health minister continue to defend the government, even claiming that the government was able to contain and reduce encephalitis deaths this year.
मुझे आशा है कि अगले वर्ष बेहतर आधारभूत चिकित्सकीय प्रबंधन, चिकित्सकीय प्रोटोकॉल सहित तथा अनुसंधान के जरिए इस बीमारी पर कारगर नियंत्रण प्राप्त किया जा सकेगा.
154 babies died due to negligence. Parents left in tears as politics was being played over the deaths. Mirror Now asks, will Nitish Kumar admit state failed Bihar's babies now? Let's debate.
So here is the big question. If the government is in constant denial, saying it is not our fault, there is no negligence, there was an outbreak, we'll look into it, we'll take these many actions now, then why is it that there is a shortage of 50 to 70% when it comes to the healthcare staff? Shortage of 57% amongst doctors, worse when it comes to lab assistant and nurses. Disastrous infrastructure. And why is it that only now the Nitish Kumar government is saying we are going to set up more medical colleges, we are going to set up more training centers, we will set up more hospitals, we will add more beds? Why wasn't this done when the current Chief Minister of Bihar has literally been in power for 14 years, barring 1 year in between? Nitish Kumar has governed Bihar now for 14 years. Then why is it that now we are being told that XYZ number of steps will be taken, but Bihar government is not to be blamed? Let's say good evening to our panelists joining us this evening. Dr. Ravi Malik, CMD of the Radix Hospitals, Dr. Sameer Dalwai, spokesperson for the Indian Academy of Pediatrics, with me in the studios, Santosh Singh, assistant editor of the Indian Express, Dr. Gulresh Sheikh, spokesperson for the BJP, and Neerja Chaudhary, senior journalist, will be with us shortly. But let me come across to you, Dr. Dalwai. If a state is understaffed at every single level, they don't have the right kind of resources, they don't have enough beds, they don't have enough hospitals. A minister in 15 years, 15 years has never visited this hospital even once. What does that go on to say about the responsibility of the state?
On behalf of the Indian Academy of Pediatrics, I'd like to say that this report or this affidavit which has been filed, which you have just shared with me, is nothing short of, I mean, if it was not such a tragedy, I would say nothing short of being comical. It's ridiculous. This is nothing, and I'm very sorry to say this, but a slap on the face of those poor parents who have had the worst situation of their life when they have lost their dear and near child. And that I'm saying that because this affidavit is not clear as to what is the problem. And here it says on one of these pages, and I'd like to show this to our viewers, that breakup of known cases. We all know viral encephalitis, even a layman would understand. When I use the term viral encephalitis, it is infection of the brain caused by a virus. And the causes that they list here of known cases is Japanese encephalitis and herpes, which are viruses. And the third cause, which has caused the maximum number of deaths, is hypoglycemia. So you have Japanese encephalitis for 46 deaths, herpes for two reported cases, hypoglycemia for 356 and 122 deaths. Hypoglycemia is not a virus. What do we say? Hypoglycemia is just low blood glucose caused by malnutrition, and then whatever is being eaten from outside, maybe it's a rotten lychee fruit or whatever, is causing a further dip in the glucose, and the child goes to bed. A malnourished child without glucose stores in the body goes to bed without a meal at night, and that's why he's going into hypoglycemia. You are writing hypoglycemia and you are saying it's a cause of virus. What are you talking about? I don't think this is just a hogwash. This has no sense. Look at what they've written, that they've improved the status of the hospitals and the ICUs. We saw the filth and the dirt and the garbage inside the ward. Now you're saying all of these hospitals have all the equipment. Who has audited it? It's the thief catching the thief. You have to have an external agency, an international agency come in and audit all this, and then is the time we can even think of improving something. According to me, this report is worse than what we started off, because it's a total denial. They haven't understood that this is not a viral infection, it's a hypoglycemic encephalopathy, which we've been saying from all the channels on behalf of the Indian Academy of Pediatrics. Dr. Jacob John, Dr. Arun Shah have presented their paper 4 years back. Our president of the academy has shared this with the central as well as the state health minister, and we are shocked that at the end of the day we still get a report which has no idea what's causing the death of these children. 153, 160 children, 200 children almost dead, and this is what you come up with. I can't believe we are ever going to improve this.
Let me also, and I completely agree with you, and thank you for pointing that out, because not too many people who are not medical experts would understand that. We went through the report. If somebody will have to point this out, even to the court that goes through this affidavit, to say that, what is being written here is extremely questionable information and excuses that are being given. Here is another part. This part says that the state government has initiated a socio-economic survey in affected areas to ascertain the socio-economic factors behind AES incidents, to initiate vigorous and coordinated campaign with the active involvement of the concerned departments. Now, if you've been tracking what the Bihar government has been consistently saying, if you heard what Nitish Kumar in the assembly said just a few days ago, the headline there was that we have done a lot, that in the last few years, consistently, the number of cases reported and the deaths have come down. Now, if the government is telling us that the number of cases and deaths have come down because of our efforts, I fail to understand why 14 years after he first came to power as the Chief Minister of Bihar, does Nitish Kumar believe that now is the time to initiate this survey? Dr. Ravi, so in a simpler language, I guess what I am asking is that, are they doing too little, too late?
Definitely they are doing too little. If you see, Bihar is a population of 110 million. And imagine, for 110 million people, there are only 5,200 doctors which are available in the government sector, and just barely above 5,000 nurses are available. So it is really, there is a huge scarcity of the staff. And I must tell you, if you don't have the doctors or nurses available, how can you give the care to the children? Number one. Number two, okay, agreed, there is a shortage of staff. Then how much doctors were infused in the hospital in Muzaffarnagar to deal with this kind of a situation, which is no less than an earthquake or which is no less than a cyclone? So what I mean to say you is that if 157 children have died and you already know that you have a paucity of staff over there, there is a scarcity of staff. Not only scarcity of staff, there must also be scarcity of equipment and paramedical staff. So how many doctors were infused? If it was not possible to put more doctors over there, then how many patients were airlifted to the other places? Because ultimately we have to take care of these sick children. I must point you, this is just the tip of the iceberg. As a pediatrician, I can tell you 37% of the children in India are having protein energy malnutrition, and 1 lakh children per year. It is a very sad thing that 157 of the children have died because of the hypoglycemia, because of the encephalopathy. But I must also tell you, 1 lakh children every year they die in India just because of a simple disease like diarrhea, which is preventable and which is treatable. And as far as this thing is concerned, 5,000 doctors is nothing. If you see the illness load is so huge. There are adult patients, they have to attend to the delivery patients, and there is a limitation for every doctor. Because a doctor has to clinically examine a child, institute the treatment, and he has to analyze the whole this thing. So it is a limitation for the doctors to treat so many children. So agreed that there was a scarcity of the doctors, but then in this scarcity, at a war footing, what was done, it is also not very clear on that account. Secondly, if I tell you, let us not go by the numbers that the death rate has decreased or these things have decreased. Because the thing is, maybe the illness was not that rampant during that year, because we need to thoroughly analyze the situation. And a technical point which my friend pediatrician has also pointed out is also disturbing. After all, it is an affidavit which is being given to the Supreme Court. So you cannot put hypoglycemia in the category of viral infections, because virus is an infection and hypoglycemia is a metabolic condition. It is a totally different thing. So what my analysis of the whole situation is that the whole medical scenario needs to be revamped, and more attention should be given to the protein energy malnutrition child. I must tell you one thing. If these children were not having protein energy malnutrition, if their malnutrition status was checked in time, then there would not have been any death. Correct. For that matter.
Absolutely.
So it is very important that these deaths were preventable, and we should take a lesson from this whole story, and we should go ahead in a positive way, in a positive frame of mind. And in all the debates, these all debates, I have been participating in most of the debates, they have all been political. The opposition is putting the blame on the ruling party, and the ruling party is putting the blame. What about those small children, those who cannot even for that matter express their agony and their illness?
Right.
And I must tell you, 157 children have died, and 847 of them, they had this illness. Now the people who have survived, they would have also had, 25% of them will have long-term disabilities also. So it is a very, very pathetic situation which should be properly dealt, and the health care, not only in Bihar, all over the India, should improve.
Yes, absolutely. And you know, I know that in the last couple of weeks, when this caught the attention of the country, these death figures really shook us and really became the center of the conversation. But let's be realistic. The fact of the matter is that this happens ever so often, literally on an annual basis. And it's not just about this one hospital in one part of Bihar. It's exactly the story that we saw in Uttar Pradesh play out in the last 2-3 years. Year after year after year, little children are dying because first we are not able to give them proper food, proper nutrition, and then when they fall ill, we're not even able to give them proper health care. But who cares, Dr. Gulrez, because these issues don't matter during election time. Elections are not won or lost on the basis of the kind of health care you provide. So how does it matter?
No, everything matters, even in election. And as far as this tragedy is concerned, I don't want to talk politics on it, because I am also a professional doctor. So I have the doctor's feeling also. So I am talking about the crux and the problems. We accept that there is acute shortage of doctors, and one should not forget that in India, still we are having one doctor for around 1100 people. And my government, at least in central government, in past 5 years, we have opened around 22 AIMS, and we have converted 100 district hospitals because of the same reason, because we want to increase the number of doctors. We have also increased the number of seats of the private as well as government medical colleges to increase the number of doctors per person in India. As far as the government is concerned and this disease is concerned, since 2012, the government is trying and working hard to find out which type of virus is this, and for the same, the samples have been taken from the dead bodies and have been sent to the biological lab there in Pune. But unfortunately, every time the sample has come out negative. We sent the sample even to United States. There also the sample came out to be negative. And it is true that Nitish Kumar during his regime has definitely decreased the numbers because of his work. But I'm not saying this because this number is also very large and we need to work for it. And definitely India need to work much more on health care. That is why we introduced Ayushman. We are increasing the number of hospitals. We are increasing the number of medical seats. We are increasing the number of AIMS. That is the reason, ma'am.
But do you think the amount that you are actually still in the process of announcing, let alone that getting implemented, is going to have any difference in the way the healthcare system is today or for the next 10 years? I mean, I am just reading out. I'll give you one small example, Dr. Gulrez. This is what I'm reading out now from the centre's affidavit, not the state one. Both central government and the state government viewers were asked to explain what really is going wrong in Bihar and what are the steps the individual governments have taken. Now, the central government says a host of decisions were taken following the visit of the health minister to Muzaffarpur. 100-bedded pediatric ICU will be set up at this specific hospital within a year. 5 virology labs are to be set up in different districts of the state. In adjoining districts, 10-bedded pediatric ICUs to be set up. Now, my question is, and this list goes on and on, that Dr. Gulrez, do we have to pick up each district, highlight the shockingly high number of cases and deaths, and question the government for the government to wake up and make these announcements?
Then we have to do a lot, and one should not forget, and I accept that thing, that in India still there is one hospital for 60,000 people, and that is very high number, and due to which many people lose life. That is the reason we are working for, let it be Ayushman or let it be opening new hospitals or medical colleges. Yes, we have to do a lot, we have to go a long way.
Okay, Dr. Dalwai, quickly your response
And
on
one must
that,
accept it.
and then I'll go to our other panelists.
So I am glad Dr. Gulrez pointed out that all the samples done on the cerebrospinal fluid of the unfortunate children who have passed away, there has not been a single virus isolated. Now tell me, who are the doctors from the government involved in preparing this report, who after Dr. Gulrez is there to educate them about the fact that not a single virus was isolated? Why are you calling it viral encephalitis? And why are you then trying to set up intensive care units to deal with viral encephalitis? Let me complete, be quiet please. Let me complete, please be quiet. Please be quiet, let me complete. I didn't interrupt you.
No, it is showing all the
I
samples.
didn't interrupt you, please be quiet. The point is, this is done because it's a cover up to control, cover up for the failure of the government in the last so many years to prevent malnutrition.
So, okay,
because
let me get this straight.
You said
You're
it's
saying,
no virus, it's because of malnutrition.
What
It
the
doesn't require
BJP representative is telling us is that we don't know exactly what kind of virus it is.
There is no virus.
That they have sent the samples to US. Dr. Gulrez, 1 minute. Let me get some clarity and then you can... Dr. Gulrez, what are you saying? Are you saying that right now there isn't enough clarity based on the testing that has been done on what kind of virus or what exactly is it? And if that is the case, then why is it that in the affidavit there are statistics being given on the basis of what? So then in affidavit, what statistics are being given to us?
But the strain of the virus
so what is the Bihar government telling the Supreme Court?
Pardon?
Then what is the Bihar government telling the Supreme Court in its affidavit?
It has told clearly that yes. See, any type of encephalitis, it can be n number of encephalitis depending on the strain of virus. Which strain is this? This is not coming out in a test. We are not able to establish, not only we, even the United States, we send the samples there also, they are not able to establish which kind of strain of virus is this.
Okay.
It is showing clear symptoms of encephalitis. All the symptoms are there.
So
but
I have gone through this.
Virus so that it can be treated.
So I have gone through this entire affidavit, which
runs
runs into 23 full pages. this affidavit that the Bihar government has submitted to the court, and I did not find any mention of what you are saying, Dr. Gulrez.
Absolutely.
And I think if the Bihar government or the doctors and the healthcare department doesn't know what exactly we are dealing with here, that thing needs to be told up front to the country and to the Supreme Court. Now, two of our other panelists haven't spoken yet. Let me go across to Neerja Chaudhary. Neerja Chaudhary, all of this mess and the way it has been handled.
Symptomatic treatment as per medical, I am using the medical terminology. In this case, the symptomatic treatment is being provided to the patient. And you can ask the doctor sitting in the panel.
Okay.
But you are not knowing the exact cause so that you can use the exact antivirus.
Point taken.
You are trying every type of antivirus.
Okay.
You are doing symptomatic treatment, and due to which lives are being saved.
Okay, point taken. Now let me go across to Ms. Neerja Chaudhary. Doesn't this show that perhaps there isn't enough commitment, that our governments don't really care? Repeatedly, Nitish Kumar says, well, I have done enough. The number of cases had actually gone down, except this time it is not we haven't been negligent. Do you buy that argument, Neerja Chaudhary?
No, it is true that the number of cases went down in the last 2-3 years after 2014, when it was 196 deaths. This time 157. You can make that argument, but that argument, when 157 children die whose lives could have been saved, is not good enough. It is not good enough for a chief minister to make that argument. Now, there is no conclusive proof, I went there, about what causes it, whether the causes are infective or metabolic or excessive heat. I think more research needs to be done on this subject. I think there has been some research has been done, but there has been a casualness about this whole process. But I would say everybody agrees, whether it's the government doctors, whether it's the officials, whether it's the Anganwadi workers, the Ashas, the ANN, they all agree that malnutrition is the real cause why the children die and fall prey to AES, and also to Japanese encephalitis. And many people were very apprehensive. When will the JE now strike, now that there is an onset of monsoons? So unless we attack child malnutrition in a mission mode, and that really is the wake-up call coming from Bihar, and it is also applies to other states. I'm sitting in Bombay today, and Palghar, Thane, you know, these are chronic places every year where deaths take place. So I think it is a wake-up call that this is an issue we need to address. Otherwise, really, it's a strong thing to say, but there is no future India. If in Bihar, if 48% of the children are stunted, you know, as per the NFHS 4, and the national average is 38, then that's something that you need to address. And I would give it to Nitish Kumar. I would say that more than many chief ministers, he has been sensitive to issues of, you know, social issues, economic issues, and he's given them priority. But somewhere I think this is maybe an issue, the nutrition and health of mothers and children, which he's not given primacy to as he should have done.
Yes, and you say this should be a wake-up call, and I would have thought that what happened in Gorakhpur 2 years ago would have been the wake-up call. Now, unfortunately, what just happened was it was a wake-up call only for Gorakhpur and the UP government to fix that part of the problem. They tied up with WHO, they brought in special schemes, government schemes, and they have successfully managed to bring down the number of cases since what it was 2 years ago. But here is my fear. We can't wait for 150 children to die every single time for that government, that state, that specific district and health department to wake up. And you can't wait for the media to pick it up every single time, because this is the state of affairs across the country. I mean, I am reading out data right now just for Bihar, because this is what the government is admitting to. 57% shortage of doctors, 71% shortage of nurses, 72% shortage of lab technicians, 58% shortage of pharmacists. Promises that were made in 2014 by the central government of centers that will be set up, hospitals that will be created. Many of them are still incomplete. Those projects haven't been finished. The government is now in its second tenure. This is the level of seriousness in our country when it comes to healthcare. Santosh Singh is back with us. We had a bit of an issue with the line there. Santosh Singh, is there a realization, at least within the government in Bihar, that yes, now we have to go on war footing, maybe tie up with the expert agencies and medical associations to fix this problem?
I think there is belated realization on this. What I can tell from my coverage for the Indian Express, I visited several villages to the places where deaths have taken places. And I have come down to the conclusion that primary health centers have to be improved. They have certainly raised the infrastructure. They have put the infrastructure well in place. They have got good buildings, but there is hardly any doctors. There is hardly any, you talked about the lack of paucity of pharmacists and other experts. I visited 3 blocks, Musahari, Minapur, Kanti, the worst affected blocks which reported maximum number of deaths because of AES. And I think government have pressed the panic button in the last moment. What they are doing now, they should have done at least 2 months ago. And they are talking about hypoglycemia, that is low blood sugar levels. Why they can't run the nutrition program, even I would say in plain words, the offering Sarbat program at the beginning of May, when mercury starts picking up. They are sending anesthetician and all kind of doctors, but there are hardly any pediatricians. Okay, they are saying they offer symptomatic treatment. The standard operating procedure is well in place because they only have to offer the standard treatment because it is a syndrome, it is not a disease. But vital time is lost in reaching SKMCH Muzaffarpur. If your primary health centers are good, are well equipped with doctors, not just with infrastructure and equipment, but with doctors and experts, you can save many lives. I would also talk about the socio-economic condition of the children. Most of them lived in thatched houses, mud and thatched houses, and they barely had knowledge of sundry government schemes. I can cite 10 schemes which government talks about, which government boasts about. But if you go to people, go to the affected people, they would say, boss, I just have ration cards. But what we're talking about, even experts were talking about Ayushman scheme. Yes, Ayushman scheme is arriving. It will take time to settle. But what about nutrition program? What about Anganwadi? What are Anganwadi centers are doing? What is the success rate of ICDS program?
Right.
So nutrition level is quite low. Okay, heat, humidity, malnutrition, experts have talked about it. All points well taken. But I would say it's a failure of delivery mechanism and it is belated awakening by the system.
Yes, Dr. Dalwai, go ahead.
Yes.
So I just like to put this in context. We have 2 terms here, healthcare and medical care. Medical care is what happens inside the hospital or the primary health center or the secondary or the tertiary health center, that is the big hospital or the intensive care unit. Healthcare is what is done to keep the people healthy. And if you just ask yourselves, why are these so many cases not reported from say Mumbai city or Delhi or Chennai or Bangalore? Why are they not being seen in urban areas so much? Which means there is something that is causing this problem in the rural and poor areas. And that problem is something called malnutrition. When your body, not just your own, but the mother in whose womb you are there, the pregnant lady, if there is a lack of nutrients, the body is born weak. Each and every cell, tissue, organ of the body is born weak. Whenever we have an infection from outside, it is not the antibiotic that we take that cures us of this infection. Please hear this. It's not the antibiotic or the antiviral that cures us. It is our own immunity which destroys the attacking infection. If it is a little low, the antibiotics only help to bolster that, and that's how we are able to succeed. Otherwise, with the best of antibiotics, every human being would have been saved from an infection. So it's the immunity of the body that saves the human being. And if the child is malnourished, the immunity is the first one to get hit. And because there is poor immunity, that's why these children fall prey to either some toxin causing hypoglycemia or to a virus causing an infection and causing hypoglycemia or whatever it may be. So the root cause is malnutrition. And if healthcare has to be improved, the children, the pregnant ladies and the lactating mothers and adolescent girls, and my dear friend Neerja, and we have worked so much on this, and she could tell you, we have been to so many districts all across India, and we have seen that the time when these programs for nutrition are well focused upon, the nutritional status improves, all these issues go down. Building an ICU is not the solution. We have a population of 125 crores. We can't build ICUs for all of them. We need to have promotive healthcare. Nutrition is the #1 issue there.
Okay, so then let me ask this question and let me go back to Dr. Gulrez. Dr. Gulrez, why is the government not able to understand what all of our experts are saying here, from journalists to doctors? You fix the root problem. And the root cause here is malnutrition. There was a report that came out last week that according to United Nations, 31% of children under the age of 5 will be stunted in our country by 2022. That India in its battle against malnutrition is just seeing a drop of 1% every year, which is the worst amongst developing economies. Why isn't the government understanding that that is what needs to be looked at as well?
No, government is understanding, Tanvi, and is also working for that. You let it be the midday meal program and type of nutrition we are trying to give in that. Let it be the Chikki program like in states of Maharashtra. The government is working, but still a lot of work has to be done, and I accept it, and one must accept the truth that lot of work has to be done, and we are also moving ahead in that direction. But as far as fixing of the problem is concerned, nobody can say that what is the etiology. The etiology still remains unknown. We have 2 senior doctors in our panel. You can ask them. The etiology is unknown in medical terms also. But no, yes, there is a problem of malnutrition in India. We are working on it. Let it be from midday meal or any other meals.
Dr. Ravi Malik, let's talk about some of the solutions right now. And there are 2 things that have obviously emerged in this conversation. First, what we started with, the shortage of doctors, of medical staff, nurses, lab assistants, and that's a national issue. How can we quickly solve that problem? Is there a way that we tie up with international organizations for the short term, bring in some more medical support from there to ensure that enough help is present here? And of course, the second part being malnutrition, and if we are doing enough there.
As prevention is better than cure, the first thing is that we should increase the community health. We should increase the health of the children, health of the pregnant ladies. We should run programs like anemia prevention program, malnutrition prevention programs. All these programs should be further stressed. A lot of things can be done. Like we need to increase the medical colleges. I must tell you, as our population is exploding, making few hospitals might not be sufficient. So we need to somersault the whole medical system. We need to increase the hospital strength. We need to make more doctors. See the pathetic situation. 5,000 doctors are only employed and 12,000 are required. Now on one side, jobless doctors are sitting over there, and on the other side, the vacancies are lying vacant. Similarly, it is not only the nurses and the doctors, it is pharmacists and paramedical staff also, where 72 to 70% of the vacancies are lying vacant. So we need to take proactive steps into this, and the most important thing is that we should raise the GDP. Now only 1.2% of the GDP goes to the health. It is just nothing. If you compare with the developed nations like Sweden, USA, you know, there are hardly any medical problems in USA and Sweden. There is hardly any diarrhea, hardly any waterborne infections, hardly tuberculosis or typhoid. We have a huge medical load, and we are having only 1.2% of the GDP. We have malnutrition. We have just with 1.2%, we have to fight with malnutrition, diarrhea, and so many things. I must also tell you that this is just the tip of the problem. Agreed that 157, unfortunately, deaths have occurred. But I must tell you, Lot of deaths are occurring because of pneumonia. 1 lakh children, 1 lakh children, I am again repeating, 1 lakh children are dying every year in India because of just a simple disease like diarrhea. Lot of maternal mortality rate is more. So we need to analyze not only the deaths from AES, but we also need to analyze the preventable deaths from diarrheas, pneumonias and other things. Our primary health centers can be, so a lot of things can be done as far as the prevention is concerned. Number one, increase the community health. Number two, empower your primary health centers. Number three, ICUs are not going to make much of difference, although we need to have ICUs, but preventive steps needs to be taken. Number three, more doctors, more nurses and more paramedical staff. And number four, obviously more medical colleges, and for everything we need lot of funds. I must also tell you, Ayushman scheme is very good. Ayushman Bharat scheme is very good. It is a very well thought of this thing. But you imagine that if you are providing healthcare to 10 crore people, that means 10 crore families, that means 50 crore people, and only 1% of them, they claim a bill of 1 lakh rupees, and which they are going to claim because liver transplants are happening, joint replacements happening, they are going. How this whole amount from the insurance agencies will go unless we increase the GDP. So it is very important for us to understand that at center level, GDP needs to be increased, and we need to have the preventive steps taken to improve the health of the community. I'm not going in the details of whether it is encephalitis, encephalopathy or whatever, but I must tell you, it is a disease which is involving the neurological system, and supportive treatment can always be given. It is at times we don't come to know which virus it is, but we know the treatment of it. We can manage the fluid electrolyte balance, we can manage the so many things, and we can give the care to the patient. So a lot of things can be done. And I must congratulate you for raising this issue. It is a very important issue, and it is a wake-up call for all of us.
Well, now and every other time and repeatedly, because we believe that healthcare and education and infrastructure are some of the core issues that we must constantly highlight, because nobody really does, and then governments and netas often forget about it, but these are very essential for any country's progress. Now, there are several pages in this affidavit, Neerja Chaudhary, that speak about, you know, the government schemes when it comes to dealing with malnutrition, and they say that you know, they've gone into detail with the schemes that the Bihar government itself has launched that looks at supplementary nutrition, preschool education, nutrition and health education, immunization, health checkup and referral services. That to address malnutrition, there is a Poshan Abhiyan that has been implemented. So for 4 pages, they have basically gone on to describe the steps that have been taken. So to your mind, and from what you have seen when you travel and when you speak to people, is it that the schemes are not being implemented right, or is it that we don't have enough funds and the right kind of schemes?
I think it's all of it. It's not one reason. And, you know, you asked a little while ago, why is it that the government is not able to do, why is it not able to give the kind of attention? I think the simple answer is that children are voiceless and the most vulnerable in our society. They are not vote banks. They don't, we women, you know, when our rights are affected, we raise our voice today. Children cannot. And somewhere I think they are given short shrift. The other thing, of course, is, you know, when you go, like I did this Sri Krishna Medical College and Hospital a few days ago, what strikes you once again is that you will see a 9-month-old baby looking like a 1-month-old baby. The mother, and one of the families who lost their daughter, I went to, the mother with 4 children looked like a 20-year-old herself. So underweight herself, probably early marriage, early pregnancies, frequent pregnancies, bacha kucha khana, no say in decision making, education, it's the whole works. The issue of malnutrition is not like giving 2 polio drops. It's much more complex. You have to attack things at different levels. And I would suggest that Bihar has not done badly in many things. Neonatal deaths have been reduced, stillborn deaths have been reduced, routine immunization has improved. So it's not that Bihar cannot do it. I would make one simple suggestion. Cannot Mr. Nitish Kumar, who is being sensitive to these issues, actually set up a nutrition mission under him in Bihar to give it primacy, so that the issue comes on the radar. And also, you see, because there has to be convergence and coordination between ministries. If it is put under the chief minister, which is, nutrition missions are there in many states, but they're not under the chief ministers. If it is under the chief minister, all this becomes much easier. And I think we in the media also, we need to we do one-time story and then forget it. Right. I think we need to follow it month after month after month, right, to keep that light on what is being done by the government.
Absolutely. I completely agree with you on that point, Nirja Chaudhary. Let me quickly bring in a couple of our viewers who wanted to contribute to this conversation. Aisha is on the phone line from Bengaluru. Good evening, Aisha. Go ahead, please.
Yeah, good evening. First of all, I should appreciate your channel for bringing in these issues which is happening daily in our country. And next is, this is not the only thing which is happening in Bihar. It's all over the country. In every state, in every city, you find these things happening, like the government hospitals which are neglected, and the patients are not treated well, because most of the patients going to such hospitals are poor people. And they are treated very badly by not only the doctors, the nurses, the hospital on the whole. And secondly, the government has to look into this. They're not looking into all these issues. It's just come out on the open, like on the TV, they announce big budgets and all that, but where the money goes, nobody knows. It's corruption everywhere. And they're spending so much money on building statues and bringing in bullet trains. These are not issues. We want, first thing is education, these health issues, all this to be tackled first.
Absolutely.
These are the things which has to be done.
I take your point completely, Aisha. Thank you so much for joining us. Quickly, let me bring in David, also calling us from Kochi. Good evening, David. David, can you hear me?
Hello, I can hear.
Yes, go ahead, please. What would you like to say?
Because I'm thinking, what is the role of Christian missionaries nowadays in this drastic incident? Very pathetic situation. Because they are having multi-star specialty hospitals in central Kerala and all these places. Why these Christians, even though they are a minority which is mentioned by the United Nations known as a numerical minority, but which dominates in the health field? Why can you have star hospitals in Kerala and places which is fully developed? Why can't Nitish Kumar call their help? What these missionaries are doing in the state of Bihar? Because our community service is not meant for any particular community. It is for the humanity, mankind. So I think what is happening in Ranchi, they are having a huge hospital, everything. Because I saw a multi-star hospital in central Kerala.
Right.
One poor laborer coming and working from Bihar. And they were showing all these pictures what service they are doing there. So they are.
Well, David, I understand what you're saying, and the government should figure out all the help that they can. In fact, maybe there are lessons to be learned from the Kerala government in how they tackle healthcare, because it is on top of the list when it comes to healthcare in our country. But thank you for calling, Dr. Dalwai. You wanted to make a point?
So I just like to say that absolutely what Nirja said is right. Children have no voice, and hence the rest of the country needs to stand up for them. Even if there is a death of one child, we have to fix accountability. We have to look at what went wrong. Just cover up reports are not going to help anybody. Let's take it that all of us are advocates for every child that is lost. We have lost more than 150 children here. I can't imagine this happening in any other country. Even if one child has died, I think all of us need to put our conscience together and see to it that we look at accepting the fault, because only when we accept our mistakes will we ever go ahead.
Okay, I want to just quickly go across to Santosh Singh before we wrap up this conversation. Mr. Singh, the same question that I asked Nirja Chaudhary. There is a detailed description in the state affidavit to the court about government schemes to deal with nutrition and ensuring that children get the proper healthcare checks and nutrition. On ground, what do you see? Are these schemes failing on ground?
I would not say that every scheme is failing, but overall schemes are failing. I just have 2-3 points to make. One, there should be a special nutrition program for summer, given the heat and humidity and the hypoglycemia cases in Muzaffarpur and surrounding areas. That is point one. Point two, what they did under pressure this year, maybe I think 10 days ago, they just sent ambulance to all suspect villages, all affected places, and it was like Operation Flush Out. Even a child with mild fever was brought to PSC. Why was this simple thing done before? This is a very simple step, but even a child with mild fever was brought to PSC and they just ruled out it is not AES. They were given paracetamol, kept there for just 1 hour or so and sent back. This can help. And third thing, I would say there should be third-party monitoring of government programs, especially nutrition programs, where they are delivering. There is a lack of awareness. They have created a post like Tola Sevak, Vikas Mitra, to work as bridge between the government and people, but I don't think I am afraid they are doing their job properly. See, it's only after the brouhaha the media created and all of a sudden there was attention on AES, that there was NHRC, Supreme Court, only then the government seemed to act. They should have done this 2 months ago. I repeat, had they done 2 months ago, death toll would have been much, much less.
Okay, point well taken, and thank you for bringing out, some of the local insights for the entire country to really know. I'm completely out of time, so I'm going to thank our panelists for joining us right now. But we are going to continue focusing on these challenges, on this big issue that Bihar and Bihar government has to tackle. An affidavit with any kind of excuses written and given to the Supreme Court will not work with us, irrespective of where the legal case goes, because the ground reality is what matters. And our effort will be to expose that ground reality to the entire country and then question the authority. It is not enough that consistently, slowly you have tried to bring down the level of and the number of cases in these diseases. Because you, Mr. Nitish Kumar, have been in power now for almost 15 years. 15 years is a long time. And still, it doesn't come as a surprise to anybody that states like Bihar and Uttar Pradesh are at the bottom 5 when it comes to healthcare services and all indicators of those healthcare services. 15 years, some of this should have changed at least, but it hasn't. The only thing that needs to be done now is to go on a war footing. Step up the funds that you give for health care and medical attention. Ensure that the funds are rightly utilized. Figure out what the root cause is. Knee-jerk reaction isn't going to solve this problem. The deaths may go down by a few number, but that's not the point. Every time even a single child dies, we will ask this question. And compensation to the family isn't going to get you off the hook. We need a proper plan and implementation of that healthcare vision. Thank you so much for joining us on this debate.